Hepatitis is an inflammation of the liver, most commonly caused by viral infection. There are 5 hepatitis viruses, types A, B, C, D, and E, and altogether of them, all of them affect hundreds of millions of people around the world. In the WHO European region, which actually includes 53 member states, hepatitis B and hepatitis C are most common. And it is estimated that about 1 in 50 persons have hepatitis B or hepatitis C. This number actually might be much higher in certain population groups, such as injecting drug users, men who have sex with men, or sex workers. Globally, it is estimated that approximately 1 million of people die each year from the causes related to viral hepatitis. And mostly they are cirrhosis and liver cancer. And it is estimated that up to 57% of all cases of liver cirrhosis and 78% of all primary liver cancer result from hepatitis B and hepatitis C. What is interesting is that most of the people who are infected are not aware of their status. And this happens because the disease very often is asymptomatic in about 80% of all cases. And that's why hepatitis B and hepatitis C very often referred as to silent epidemic. However, in about 1 in 5 persons, hepatitis B or hepatitis C virus develop acute symptoms. They include the following: needle-like flu disease, jaundice, which is yellowing of the skin and white of the eyes. It could be fatigue, it could be stomach pain, it could be nausea and vomiting. The hepatitis B virus is transmitted mostly through sexual contacts, but also from mothers to their babies during pregnancy or childbirth. Transmission also occurs through transfusion of blood or blood products, and also through unsafe injecting practice, both among injecting drug users and also, unfortunately, in healthcare settings. The hepatitis C virus is mostly transmitted through blood-to-blood contact, which is associated with unsafe, with injecting drug use, blood transfusion, or with the use of poorly sterilized medical equipment. It also can be transmitted through the sexual contacts, or through mother to child, or from mothers to their babies during pregnancy and childbirth. However, this happens much rare compared to the transmission associated with blood. To prevent yourself from getting infected or to prevent further spread of hepatitis B or C, you should do the following. First of all, get vaccinated against hepatitis B. Get your blood test if you think that you might have been at risk of infection. If you think that you might be infected, or if you know that you're infected, then try to prevent further transmission of this infection to other people. And mostly you can do that by having safe sex and using condoms, and not sharing needles or syringes or other equipment in case you inject drugs. Many people can completely recover from hepatitis B or hepatitis C infection within the period of several months. However, hepatitis also can become chronic, and in this situation you would really need to go to doctor and to receive proper treatment and care. What is important that new and effective medications become more and more available, so the best thing would be to consult with your doctor on their possibilities. It's also very important that you would raise awareness for the disease to your family, to your friends, to your partners, and encourage those people who you think may have been infected to go in to test their blood and to know the results, and then in the future to get treatment and care.